Hi guys, welcome back to my channel. It's Keso's Corner, and today we'll be talking about a very important subject. Stay tuned for the topic. So today we'll be talking about some myths on breastfeeding. We'll be demystifying 6 main myths about breastfeeding. This week is the breastfeeding week, so we are talking about breast milk, breastfeeding, everything about the mother and the mother's breast. Breastfeeding has several benefits for the human body. It has a lot of benefits for the mother and the baby. So for the mother, if you are breastfeeding, especially exclusive breastfeeding, then you're going to gain so many benefits. And trust me, these things are not just things we say, but they are things that a lot of mothers benefit from. So let's look at the benefits of breastfeeding to the mother and the baby. But before we do, don't forget to like this video, share, subscribe, and comment. You can also suggest which new topic you want us to handle, and I'll take a look at it and we'll discuss it in our subsequent videos. So, to the benefits of breastfeeding for the mother. When you breastfeed as a mother, it helps you to lose weight. Yes, breastfeeding will help you lose all the weight that you're gaining while pregnant. Not 100%, not all the weight per se, but then breastfeeding also helps you lose some of your baby weight. So if you are a pregnant mother and then you are almost delivering, or you're a mother who is breastfeeding, I'll encourage that you continue to breastfeed because it's going to help you lose a lot of your baby weight. Breastfeeding also helps in the contraction of the womb. So if you are breastfeeding, then it helps you restore the normal size of your womb. So mothers who want, to get the shape back very fast, it is important that you breastfeed, and exclusive for at least 6 months as recommended by the World Health Organization, that is the WHO. It is mainly a body that sees the health of the whole world. Okay, so from our last video, someone gave me feedback that these terms should be broken down. Then, as part of these bodies, you also have the UNICEF. They all encourage that we exclusively breastfeed our babies for at least 6 months and continue to breastfeed them until they are 2 years of age. Studies have shown that breastfeeding your baby also helps to protect the mother from developing certain non-communicable diseases like cancers, diabetes, hypertension, etc. in the near future. So breastfeeding your baby helps protect you, the mother, from diseases. Aside that, breastfeeding the baby helps in bonding. So it helps to build a strong bond between the mother and the baby. These are some of the benefits of breastfeeding to the mother. Let's look at the baby. Breast milk gives the baby excellent nutrition. So from nutrients, water, fats, oils, everything the baby needs to grow is in breast milk. So optimum nutrition for optimum growth of your baby is in breast milk. That means it is the ideal food for the baby. For starters, unless there's any contraindication, then breast milk is the best for your baby. Breast milk has appropriate amounts of digestible proteins for your baby. By this, I mean giving your baby other food or other milk products that are not necessarily breast milk will mean that your baby is not able to digest the food well and also get all the nutrients out of it. Babies are able to digest a certain type of protein known as whey protein, and then the proportion of whey protein in breast milk is a good amount so that the baby is able to get enough nutrients from the breast milk. Breastfeeding your baby will mean that you are passing antibodies. Antibodies are basically disease fighting cells in our body, okay, or disease fighting components, things that help make up our immune system. So, in giving your baby breast milk, you, the mother, transfer some of these antibodies from your body to your baby. This will help build your baby's immunity and your baby can fight diseases. Aside that, breast milk is sterile. It's just direct from the body, no contamination or any other thing. So when you give your baby breast milk, you are protecting your baby from all these infections. Giving your baby breast milk also helps the baby build a good amount of something we call normal flora. So the normal flora basically are organisms though, but then they inhabit our body and then they protect us and prevent the bad ones from getting space to populate on us. So when you breastfeed your baby, you give your baby some of these healthy organisms, and then your baby's good to go. So enough with the benefits, the mother, the baby, preventing the baby from becoming obese, prevents your baby from developing non-communicable diseases later in life, the diabetes, hypertension, the cancers, etc. Let's go straight into the myths about breastfeeding, and then we will debunk them and know the truth. Okay, so myth number one, breastfeeding is easy. Hey, don't ever say this to any breastfeeding mother, especially our husbands, the men, our loves. Don't tell any breastfeeding mother that breastfeeding is easy. As a matter of fact, breastfeeding is not easy at all. But I would also say it's difficult. It is a skill that the mother will learn. Mostly children are born with the ability to, they have the reflex to suckle, but then it's not easy maintaining that thing. So the mothers really go through a lot to first off initiate breastfeeding and the thought of even continuing breastfeeding. So because breastfeeding is not a joke, we have to support our mothers, okay? So like the fathers, when they come from the hospital with our precious babies, we can help them by, doing the dishes, cleaning the house, so that after everything, they also have time to rest and breastfeed the baby. When mothers are stressed, it's very difficult to produce the milk. Okay, so if we want breastfeeding to be easy for these our lovely mothers, let's support them. It's not just the husbands, family, friends, in any way that we can support. And our grandmothers, please don't rush with the cuckoo. 2 months because breast milk is not flowing, then we start giving the baby all sorts of things. No, we need to encourage the mothers, support them, help them distress. If they are really having serious difficulties, it's good to speak to them or help them reach a professional. You can speak to your dietitian, your midwife, your nurse, your doctor, and where you go for your weighing, your community health points. You can also go there and seek for support, and we are ever ready to help you with your breastfeeding problems. Myth number two, you cannot breastfeed if your breast is small. This one, yes, I know. We all know. We've heard it. But as a matter of fact, when it comes to breastfeeding or breast milk production, it's got nothing to do with the size of the mother's breast. Let me explain. The size of the breast does not determine the amount of breast milk you can produce. The size of the breast is basically because of the amount of fat tissues that we have as women. So a woman with bigger breasts doesn't mean she can produce more breast milk, because it's just because she has a lot of fat in her breast. The alveoli, that is the tubes in our breast that produce the milk and all that, okay, is the same for almost every woman. So it doesn't have to do with the size of your breast. If you have small breasts, it doesn't affect breast milk supply. But on the other hand, a small breast is like a small container. So if you have a small breast, that means you cannot store a lot of breast milk. So because of that, you have to do very frequent feeds for your baby. If you can express after I feed, you can do that, so that when your baby needs to feed, you always have some excess. But it doesn't mean you're not producing enough breast milk. The size does not matter. The size does not matter when it comes to breastfeeding. Myth number three, wash your breast before breastfeeding your baby. Wash your nipple before breastfeeding your baby. All these things about washing. It's good for the mother to keep personal hygiene, as you are taught at your antenatal and postnatal clinics. So breast hygiene is very important. But then you don't have to wash your nipple before every feed. As a matter of fact, the baby knows the mother by certain things the mother secretes, certain substances. So when the baby smells it, they know that it's their mother, okay? And when you're always washing your breast, these microflora, the things I was talking about that, populate our body and prevent the bad organisms from getting in touch with us. As you keep washing your breast and your nipples before feeding, you get rid of them. So your baby is not able to benefit, okay, So you do not have to wash your nipple or your breast before every feed. But then the regular personal hygiene tips that you've been taught, yes, you have to go through those ones. Myth number 4, breastfeeding would damage your breast. Yes, a lot of people do not want to breastfeed. In fact, studies have proven that it is one of the most mentioned, reasons why mothers don't want to breastfeed, because it's going to destroy their breast. As a matter of fact, nursing alone will not destroy the shape and the size or the texture of your breast. Pregnant mothers can testify to the fact that pregnancy alone can change. You will observe changes in your breast when you are pregnant, when you are breastfeeding, even as you age. Okay, so many things factor into our breast shape and size. It's not just nursing. So please do not deprive your baby of all the benefits they can get from breast milk just for cosmetic reasons. It may be your very, very important concern, but let's look at the benefits to your baby and the benefits to you also as the mother. Okay, if you're overly concerned about this, you could speak to your beauty and healthcare experts. They can teach you the way to go about it. But as a matter of fact, feeding or nursing alone does not destroy your breast as a mother. Myth number 5, you have to wait for your breast is full before you start breastfeeding. This is never true. As a matter of fact, when you breastfeed your baby, you don't empty your breast fully, or there's no point in time when you don't have milk in your breast. So what happens is, the more you space out your feeding times very long, so you don't let your baby suckle frequently, that is what can actually affect breast milk supply, because the suckling from the baby is needed for the release of breast milk. Okay, so you don't have to wait until your breast is engorged before you feed your baby. You can feed your baby at all times. Some people also say that your baby is using you as a pacifier if they always want to breastfeed and all that. So you have to keep the baby away. You don't always have to carry your baby. You have to feed your baby on demand as many times as your baby wants to. Okay. Sometimes the babies will want you to carry them for comfort. And it's a good point. Yeah, their mother, you have to comfort them. So don't go and do obey and saba, and they can't understand. Then you put the baby down, the baby is crying. No, when your baby is crying, your baby wants milk. Give the baby the milk on demand. After all, the breast is for the baby. Until the baby is tired of the breast milk, it's for the baby. Don't let anybody, not even your husband, tell you to put the baby down. Okay. Myth number 6. You must be on a special diet when you are breastfeeding. This is 100% untrue. You don't necessarily have to go on a very like breastfeeding diet. I get that question a lot of times. You just have to eat healthy and stay hydrated, and that is enough for a breastfeeding mother. On the other hand, when you start breastfeeding, your body will demand a little more calories, so a little more food, a little extra than what you are already eating. And most mothers, your portion sizes will change naturally. Okay, and every mother, and then the adjustments that must be made, but you don't necessarily have to eat for 2 or for 3. Sometimes it's just an extra meal added to your regular meal. An assessment has to be done for you, but mostly, like I'm saying, your body will demand, so you yourself, you see the increase in your appetite and you're able to do the adjustment. But you don't have to buy any special breastfeeding supplements and all that. Well, it works for some people, but it's not a must. You don't necessarily have to, lose money in that area. Do more fruits, vegetables, proper hydration. Make sure your food is balanced, enough proteins, carbs. That is not a time to go on any restrictive diet. A lot of people will say, oh, because I'm breastfeeding, I'm going on a bland diet. So no pepper in their food and all that, because they believe the pepper will go through the breast milk to the baby. No, you can eat your regular meals. Aside the things that are contraindicated during pregnancy and breastfeeding, like alcohol, smoking, and the rest, regular healthy meals you can have when you're pregnant. Yes, so that was another lovely time spent with you in my corner. And like I said, because this week is the breastfeeding week, we wanted to talk about breastfeeding and then some of the myths that are we hear about breastfeeding. I hope you learned a lot. Even if you are not breastfeeding or you are not having a baby yet, you can pick some one or two things and then teach somebody. But before I sign out, I want to encourage and support breastfeeding mothers. It is not easy to breastfeed, and breastfeeding has a lot of benefits, reducing the rate of children, the number of children that are dying, infant mortality and morbidity, so how they fall sick and all that. Some studies have even shown that it goes a long way to determine how you're going to get certain diseases later in life. Breastfeeding is very, very, very important. And we want to get to a point in this our world that every child benefits from breastfeeding. At least the first 6 months, when your child is getting only breastfeeding, that space, that's a lot for the baby. And beyond that, we encourage that you breastfeed your baby till about 2 years. But for how long you want to breastfeed after your 6 months depends on the mother and other factors. Okay, so let's support them. Those who are working, the bosses, be lenient with your workers who are breastfeeding. Be lenient with them. The husbands, understand them. They are not being lazy. Breastfeeding alone is a job. So let's support them with the chores and all that, encouraging them. If the mother is overwhelmed, the breast milk is not coming, it's not the time to say, I told you to eat, you didn't eat. No, no, no. Rather, bring the food and let them eat. Give them a massage, a back rub, anything to make them feel better. Let's pamper our mothers who are breastfeeding so that they can also supply the milk to our babies. So on this note, thank you so much for watching. If you are still with me this far, I hope you enjoyed the session and you learned a thing or two. Until next time, this is Kesowa's Corner. Don't forget to like this video, subscribe, share, and comment below.